they don't have the ability to tell you how they feel. And so when your loved one is acting oddly out of the blue, that is not normal, whether they are overly tired, um, mean, mm, just off. Like if you're with your loved one a lot, you know when they're just off and there's something wrong, like personality wise, have your loved one tested for a UTI.
Lexie Callies, do you feel the squeeze of caring for an elderly loved one and school-aged children? Then welcome to the Sandwich Stories. Let's dig in.
Hi everybody. It's Lexie Callies with Sandwich Stories. I hope you're having a really great week. Um, and this is maybe a little bit of a topic that some people might find maybe not something to talk about, but it is a fact of life whenever it comes to dealing with the elderly is urinary tract infections and UTIs, especially in women. Um, and I'm bringing it up because my mom just got diagnosed with one, and I asked the reason why we got her diagnosed was because I asked to have one done because she was acting a little odd. She was being very contrary this weekend, just like not nice to me at all. It was not your normal Peggy. It kind of started seeing it Thursday. I kind of let it go. She was at physical therapy, but Saturday came and she just was not nice to me, and I knew something was up. So I asked for a UA, a urinary analysis, and it came back positive, and we are going to go get the antibiotics today. I'm waiting for the pharmacy to call me to say that they're ready to pick up. But this is just a fact of life, and a lot of the times, the elderly don't show the symptoms that a lot of women might show when they were younger. So or they don't have the ability to tell you how they feel. And so when your loved one is acting oddly out of the blue, that is not normal, whether they are overly tired, um, mean, mm, just off. Like if you're with your loved one a lot, you know when they're just off and there's something wrong, like personality wise, have your loved one tested for a UTI. And like I said, this is something that I know people don't love talking about. They think it's gross. It's just part of caring for the elderly. And um, you know, it's little things. Like I think back, my grandmother would get them, and you have to realize you have people who might, if they were living by themselves, they might not be able to clean themselves properly after using the toilet. And so then that can cause a UTI. You have loved ones who are wearing pull-ups, and as much as you change them and as much as you clean them, still yet again it's a possibility for a UTI. Men can get them too. I It's rarer for men to get a UTI, but it is 100% possible that they are able to get UTIs, especially if they're more bedbound, especially if they have to wear a pull-up of some sort. So don't think it's just for women in your life. I would, if your father, husband, whomever is acting oddly, I would also have them checked for a UTI. And it's amazing. After a day or two, you start to see, after a day or two of antibiotics, you start to see your loved ones kind of come back and their personalities back to the way they were before. And you're thinking, oh, here we go. Yep, it was a UTI, 100%. Um, so that's why I bring this up. Like I said, my mom just got diagnosed with one. Her personality was off. She was not being kind to me. She was um, giving the staff a little bit of pushback when it came to taking her meds, but she wasn't being mean to them. We all, our loved ones normally get the brunt of whatever is going on, right? So it was me. I was getting the brunt of it. And so I just knew to ask to have it called in and double checked, right? So don't be afraid to have this done. Um, don't think that there's some have this done first. Don't think that there's a drastic change in your loved one's mental status, and that you have to rush to the neurologist or the doctor, thinking that there's something wrong, especially if they have dementia or some other neurological disease. Try to have them tested for a UTI first, and you might see them change. So after a week, try the antibiotics. Now, if there's still stuff going on, then yes, have them looked at. Oh, the other thing too, have the UA cultured, right? So there are so many different antibiotics and there's different bacterias. The best thing to do is to um, get a UA, have it cultured, and then have the right antibiotic for that culture. So you're not taking an antibiotic for 2 days and then the culture comes back and it says, oh, wait, that antibiotic isn't going to work. We have to go to this other one and then start the regimen all over again. So sometimes it's best, if you can, to wait a day or two for that culture to come back so you get the right medicine right off the bat. And it is harder because people give antibiotics for all sorts of reasons and maybe for things that aren't even bacterial. And so that is why getting a culture is the best way to go. You don't want, everyone is talking about creating a superbug, overusing antibiotics. And even in the elderly, if you don't have to give them a medicine that they don't need, that's not going to work for them, don't do it. One less thing. My mom is allergic to Bactrim. She gets a rash. Turns out I now get a rash from Bactrim. I didn't know, but now I had it not too long ago and I got a lovely rash on my neck. It was not great. It was itchy and hot. So now I know not to get Bactrim. And so that's the one antibiotic she's allergic to. So we make sure she doesn't have that. And yeah, so hopefully the old Peg will come back. The happy Peg will come back. She has been very tired lately, so I know she's not feeling well. Um, and so I'm hoping this will help out. And we'll get her back on the straight and narrow, right? We'll get her back to on the right path, so she can participate in physical therapy, participate in activities at assisted living, be nice to me, and uh, yeah, she'll be back to normal. And that is hard. I have to say, when you have a change like this due to UTI and your loved one is mean to you, it is very hard as a caretaker to take whatever is coming at you that you're not used to getting. Now, there are some elderly people who are mean, and sometimes they have every right to be mean. They're maybe not every right to be mean, but they're just, sometimes they've always been mean people. And so you know what to expect when you have somebody who is not mean and then all of a sudden is mean and saying not nice things to you. And it does make you feel horrible about yourself. Um, I've been there before in the past, and it just felt like a different Peggy that I had never seen before. And she was just saying horrible things to me and made me cry and made me feel horrible. And so now I know to double check for UTI. And then maybe that's just the reason, right? So if you're in pain, she can't tell us she's in pain, or she doesn't realize she's in pain, then maybe it's coming out in the way of her being mean. And so we're going to get her all fixed up, feel better, and we'll get her the old Peggy back. Yeah. Um, so just know that this happens. There's nothing wrong with talking about it. It needs to be known. It's one of the first things people will say, hey, have you had them check for a UTI? You know, because maybe they've had it for a while and you just haven't even realized it. Not a UTI, but my Grammy, my grandmother, would always have a drippy nose. And we just thought, oh, she's, it's just drippy nose. Turned out she had a sinus infection for ages. And then once we figured that out, her drippy nose it was insane. So even little things like that, she wasn't going to complain. She couldn't complain. And she always had her tissue and she was always wiping her nose. and it literally was just like clear water dripping out of her nose, and it was a sinus infection. I couldn't believe it. I got that sinus infection cleared up like that, and the drippy nose stopped. The faucet stopped. It was kind of interesting. So sometimes check for those kinds of things because they're just not showing up the way they would in younger adults. And that's why there's gerontologists. They will always say their pediatricians are there because illnesses in children show up differently than they do in adults. And once you get to a certain age, illnesses show up differently in geriatric people, differently than they would in younger adults. So just things to think about and to look at and to say, oh, well, maybe I should have that checked out. I mean, it's simple, it's easy, get it done really quickly. And if it's not, then that's when you go and maybe the next level, have it checked out at the PCP and or your neurologist and see if there's anything else going on. So, with that said, um, the song of the week is going to be This Is Me from The Greatest Showman. I think this is a great song. I love The Greatest Showman. I think it's a wonderful movie. It's great to watch with I think my son was about 8 when we watched it with him. And I love a musical, so there's that. But even oh my gosh, my husband loves this. He thinks The Greatest Showman is the greatest. He loves this movie. So This Is Me makes you feel strong, empowered, just a better person, and maybe it's what you need to get through the day if you're having a tough time. Yeah. So I hope you all have a really great week, and I will talk to y'all soon. Okay. Love you. Bye.
Thank you so much for listening to Sandwich Stories. I really hope you learned some new things and enjoyed it. If you did, tell a friend, tell your mom, tell your sister, tell your dad, tell everybody you know to also listen. Maybe they'll learn some new things, how to help each other out, and find us at Sandwich Stories Podcast. Thanks so much.